This video is going to go over the concept of prescribing exercise using heart rate reserve. The reason we need to talk about measuring heart rate when someone is exercising is to determine how intensely are they exercising. The ACSM recommends that patients participate in moderate intensity aerobic exercise for a minimum of 150 minutes a week. How do you know if your patient is in the moderate zone? So these recommendations are a way to prescribe exercise to get aerobic adaptations. It's similar to knowing that you're overloading a strength training muscle to the percent of their 1 rep max to make adaptations. We need patients when we are using aerobic exercise as the type of exercise that we're prescribing to make change over time. We have to make sure that we're prescribing the intensity correctly. It is much more simple to use an exercise intensity that describes what percent of someone's heart rate max are they exercising. Heart rate max is the same for an individual, not dependent on their aerobic fitness. It doesn't change with training. The only thing that affects heart rate max is our age. So it can be an easy way to say what percentage of your max are you exercising at to determine if your patient is truly in the moderate range. When you are using heart rate max or a percent of heart rate max, there is a range of intensities that would be appropriate for moderate. So if you look at the chart in your notes, it says that anywhere from 64 to 76% of heart rate max is considered moderate intensity exercise. For the purposes of the class example, I just picked 75% of heart rate max to describe the moderate intensity. Doing the range would have just been more math, but you certainly could calculate what's 64% of the heart rate max and what's 76% of the heart rate max, and you would get a range of heart rates that would be appropriate for moderate intensity exercise. So in our example, we said we had a 70-year-old person. Since heart rate max is based on age, you can calculate their heart rate max. The equation to calculate heart rate max is 208 minus 70% of the person's age. So for our patient, who is 70 years old, 70% of his age gives us a heart rate max of 159 beats per minute. So if we were just going off of heart rate max, all you would have to do is take 75% of their heart rate max and you would have a heart rate number that you're shooting for. So if you just simply took 75% of 159, you would see that 119 beats per minute is an appropriate heart rate intensity to be at moderate intensity. And that is a fine way to do it. It's not as accurate or as specific as using heart rate reserve. Heart rate reserve takes into account a patient's heart rate rest. So you take heart rate max minus their heart rate at rest. What is their heart rate at rest? Minus their heart rate at max. And that gives you the range of heart rate beats that you have to play with. How many beats do you have? This is your heart rate reserve. Because heart rate rest is a factor that changes with fitness, this is why heart rate reserve is a more accurate way of prescribing exercise intensity, because it takes into account your patient's underlying fitness level. Percent heart rate max does not take into account your patient's overall fitness. If you take into account their heart rate rest, your prescription for aerobic exercise becomes more specific. So for our 70-year-old, in class we use 2 different examples. One person who has a heart rate rest of 50 beats per minute, and a second individual who has a heart rate rest, of 80 beats per minute. So for each of these individuals, since they're both 70 years old, their heart rate max is 159. For patient A, heart rate reserve, since it's heart rate max minus heart rate rest, is 159 minus 50. This individual has 109 beats to play with, 109 beats in which they can raise themselves above their resting value. Whereas the person who is in B also has a heart rate max of 159, but is starting from a place of 80 beats per minute. So their heart rate reserve is only 79 beats. These individuals have a very different kind of tank to play with. How much above rest are they able to raise? Person A has a greater range of heart rate beats to play with. So you can prescribe heart rate using the heart rate reserve equation by saying a patient's target heart rate is whatever their heart rate rest is plus the percentage of that range of beats they have to play with. So we're going to have them go 55% of their heart rate reserve beats. I have chosen 55% of heart rate reserve for this example because if you look at the chart, 55% heart rate reserve is moderate intensity for heart rate reserve prescription, whereas 75% of heart rate max is moderate intensity. So these numbers, if you look at the chart, is just simply the numbers that represent moderate intensity. So target heart rate is heart rate rest plus the percent of exercise intensity of your heart rate reserve. So our patient has a resting heart rate of 50 beats per minute, and we want this individual to be exercising at 55% of their heart rate reserve. So we're going to multiply that by 109 beats per minute. So when we do the math on this, we would be happy if our patient is exercising with a target heart rate of 111 beats per minute. We could do a similar walkthrough for patient B. Target heart rate equals heart rate at rest plus 55% of their heart rate reserve. This patient's heart rate rest is 79 beats per minute plus 55% of their heart rate reserve, which is 79. Just realized this should be 80, not 79. I'm going to do that again. Their heart rate rest is 80 beats per minute and 55% of their heart rate reserve, which is 79. So this individual, for a moderate intensity, has a target heart rate of 123 beats per minute. You see, these two people have very different targets to be at their exercise intensity. Patient A is moderately intense at 111 beats per minute, where patient B is moderately intense at 123. This creates a more specific exercise program so that you're sure your patients are truly within the moderate range.